So this is the first level exercise to work on hanging from the arms. So hanging over time, and we're talking days, weeks and months, hanging re-establishes correct shoulder position and lengthens that muscle, lengthens out the capsule, the labrum, all sorts of stuff. So our body's actually designed to be hanging, and it's seen by just anatomy studies, which I'll show an image of right now. And what it's called is brachiation, which brachiation means the arm. So it's just the arm hanging from some structure, stretching all the needed muscles so the shoulder actually moves without impingements and moves more easily, opens up the rib cage, all sorts of stuff. So what we need to start with this first level, so there's a few levels of this, is a power band. So most gyms have these days. They're quite thick and they're quite strong. What it is not is a TheraBand. So this is a short one. The TheraBands are really thin, really stretchy. They're used for more different types of exercises. The power bands is what you need for this. And you can buy these at Kmart for about 15 bucks anyway. So I'm putting this over a door over the top. And then I'm grabbing one. I'm just kneeling down. And all I'm doing is just letting my body just hang off here. So I'm not trying to use any muscles. I'm not trying to pull down. Not anything, just letting my shoulders do what they want to do or need to do, just hanging and stretching. And I start off with 30 seconds, and I do 4 lots of 30 seconds. And over time, I build this up to about a minute at a time, 2 lots of 1 minute, until I can do 1 minute in one go. So that's the first thing. And what I can do from here is that when we hang this way, the ribs actually flare. So the ribs actually flare out like this. That's normal. So what you can do is and it actually doesn't let the upper ribs or the back release that well. So it's a good stretch, and you can do it that way for sure. But you can also play with breathing out. So when I breathe out, like I'm fogging up a mirror, that sound actually makes these ribs that are open like this come in. And it works, it gets my obliques activated to pull that in. So then when I'm breathing, the air can go up into my chest and expand the front of the chest, expand the back of the chest. So as I'm doing this hanging here, I'm keeping this sense of in my breath, in my torso, but I'm also allowing a bit of pressure to stay here, but I'm breathing, letting the air come into the upper part of my chest. So what that looks like is this. So I'm just hanging to start with, and then I'm breathing out. Keeping a bit of tightness in my abs now, side abs. Breathing up into my chest, up into my back. And you'll feel it quite a much more intense stretch, and it'll you can feel the ribs actually flaring and opening at the top. That's another good way of playing with this hanging, and I'll show progressions in the next lot of clips. If you were to find that when you're doing the hanging work this way, that it stirs up your elbow, if you have like an existing tennis elbow or golfer's elbow, like tendinopathies. So gripping can be a bit of a barrier for people. So you can pop the band through like this and do the hanging the same, just so you don't have to grip with your hands, but you're actually pulling more with the wrist itself. So you can just organise itself around the band this way, another advantage of using the band. It's possible that you may feel impingement pain. Anytime you lift a shoulder in any motion and it feels like there's pain, there's some kind of impingement there, and there can be a tendon problem, there can be a labral tear or issue with the labrum, just tight muscles, tight capsule, all sorts of stuff. But in the end, it's a type of impingement, which just means that things aren't moving and rolling in the joint as smoothly as it could. And a common one is when people lift their arm, they feel it sort of pinchy through here. That can be cleared. That can be cleared in different ways. If you find that doing this, it causes that pain, it's like it's aggravating it, and it doesn't release within about 30 seconds, let this go and do another type of stretch. And the best one to do first is grabbing underneath a door handle. So with the palm this way, so not down but up this way, and then hanging off the door, so my hips are away, head is away, and I've actually got this sense of hanging off the door, and it gives this sense of traction through the whole arm, gives a depressor effect through the shoulder, and I hold that. I'll do 4 lots of 20 seconds of that, and then you can try doing the hanging work after that. And if there's no change, you need to spend more time doing this sort of stretches, stretching the back of the capsule first, even the front of the capsule, front of the pecs, before you can get into this. But this is a good thing to get into once that impingement is cleared.